When Professor Muhammad Nasir Sambo assumed office as the Director General NHIA, his target was to make sure every Nigerian, irrespective of status, is covered by health insurance. But without the deployment of technology, this goal cannot be achieved. Hence, the introduction of the eNHIA project that will help automate all NHIA processes or operations. Given the nature of health insurance, ICT will play a big role in the integration of stakeholders and validation of enrollees within the health insurance space. The program tonight brings you an insight into the initiative and how far it has helped to increase coverage. My name is Aisha Muhammad Ahmed, your regular anchor, welcoming you to the program Easy Access to Healthcare for All, sponsored by the National Health Insurance Authority. Join me after the break for more on this. Keep watching.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
We begin the program with the news. In our lineup, NHIA boss attends National Order of Merit Award, just as Go Health holds its last Providers Forum for 2022.
So we're supposed to be the ones collecting something.
The Director General, Professor Muhammad Nasir Sambo, has attended the 13th Annual Forum of Laureates of the Nigerian National Order of Merit in Abuja.
It was very.
While at the event, the DG delivered a lecture while enlightening participants on the NHIS, its transition to NHIA, as well as the new eNHIA Act.
When you are to use health insurance as a platform for attainment of universal health coverage, is to ensure that the law will make provision for the vulnerable segment of the population. Because if you look at the population, as I alluded to in the first slide, over 92.6% of the people are poor. And if you are grappling as to how to make 3 square meal, how will you be able to finance for your health care? So the law must be able to make provision for the vulnerable, a situation whereby government somehow will have to mobilize resources to pay for the poor.
The two-day meeting was organized to stimulate and reward intellectual, academic, and professional excellence for national development in Nigeria. The Gombe State Contributory Healthcare Management Agency, Go Health, held its final provider forum for the year 2022. Bringing goodwill messages on behalf of the healthcare providers, Dr. Garba Saidu appreciated Go Health's commitment to ensuring that Gombe State residents enjoy a seamless and stress-free health care, which is not only affordable but also accessible. Garba noted that healthcare is comprehensive and Gombe is already on its way to overcoming the difficulty in accessing health services, noting that it has reduced the frustrations faced by those who prior had to pay for their medical services at a cost. Garba further challenged the providers to be accountable in all their work because they stand to be beneficiaries of the very precedents they set. Thanking the healthcare providers for a productive year, the agency's team leader, Dr. Abubakar Musa, reiterated the agency's commitment to ensuring beneficiaries have the best of care. He noted that the year has not been without its challenges, but he thanked the third-party administrators and healthcare providers alike for their resilience and commitment to mitigating the challenges. He noted that there is still room for improvement, even as Go Health is anticipating more informal sector enrollment and also the onboarding local government employees soon.
The program is Easy Access to Healthcare for All. ICT is one of the initiatives that the NHIA under Professor Sambo is using to drive the achievement of universal health coverage. On the issues this week, we will take a look at some features of the eNHIA project and how it has fared so far. Please stay tuned.
The NHIA is saddled with the responsibility of attaining universal health coverage by 2030. What this means is that in less than 10 years from now, almost every Nigerian should be protected by one form of health insurance or the other, so that they do not have to worry about paying for healthcare out of their pockets. Little wonder then that when Professor Muhammad Nasir Sambo came on board, ICT was on top on his agenda. One thing that Professor Sambo identified to make universal health coverage a reality was the need to bring all stakeholders on board towards achieving a common goal. Hence, the interoperability of the eNHIA project, which integrates stakeholders together and makes accessibility easy for enrollees from the comfort of their homes.
Enterprise resource planning, whereby
Professor Sambo explains further on the automation of the NHIA operations.
NHIA has done quite a lot in building a very critical infrastructure for health insurance in the country. In fact, the infrastructure we built is across the country, so that the entire ecosystem, social health insurance ecosystem, will be integrated. We want to move to a level whereby from the comfort of your bedroom, you can use your smartphone and enroll. Maybe to the level that you can, even if you want to subscribe, you can subscribe, so that you can be registered and just be moving to the hospital. This is the level that we are trying to take the organization to. And I'm sure in not too distant future, this digital investment that we have done will begin to be put to use for the benefit of our team enrollees.
Other efforts to further actualize the health insurance is the validation of already onboarded enrollees.
We have integrated our database with NIMC. We know that NIMC manages the identity of Nigerians, and identity is a very big issue in health insurance as in other sectors. So what we have done is that we have harmonized our database with NIMC, and we are now using NIM as a unique identifier to enroll Nigerians into the scheme. We are also finalizing the arrangements to do NIM validation for the enrollees that are already in the database. We'll go nationwide. We'll start sectorially, maybe with police, with other organizations. We validate every Nigerian enrolled into the NHIA presently. Before the advent of this technology, we've had some lives have been captured. So we want to validate the record.
It doesn't stop there with the eNHIA project.
And another thing we have been able to put is to build analytics on the database to monitor our encounter, to monitor our growth rate. These are used, we call it predictive analysis, to see through encounters, to be able to see disease patterns growth. And then government can use all this data to plan to mitigate any form of outbreak of diseases here and there. We can predictably give the government the data. Also, our international partners will rely on this to know when they will send aid. So before, we call it analysis of occurrences. We look at patterns in growth. We look at patterns in health and in encounters at facilities. So we're able to predict.
Another critical move that will help solidify the move towards universal health coverage is the responsibility of stakeholders within the health insurance ecosystem.
We all have a role to play, all the stakeholders, and our king in the sector are the enrollees. What we are seeing right now, we are moving into the digital era. Enrollees will also help. There are things you can do and check by merely visiting our website, nhis.gov.ng. You have some information there. So by the time we fully go into self-service, enrollees should be able to handle updates on their data. They should be able to, they're going to be able to add or remove dependent as the case may be, because there will be very, very comprehensive security and then checks to ensure that such facilities are not abused. So you'll be able to check the status of the enrollment, you'll be able to add your dependent, extra dependent as the case may be. So it's a self-service. So what we're saying is that enrollees should also get themselves informed about their health insurance. I will tell you that even before now, you ask some enrollee, they will come and what is your NHIS number? They don't know. As important as health insurance is, you don't know your NHIS number, yet you know your phone numbers. So right now, enrollees should begin to look into such aspects. Technology is being made available. What are the opportunities there? Well, so for the healthcare facility, they also have to upscale their operations. What we are seeing right now is that we have engaged the healthcare facilities and also the HMOs on our minimal requirement by which you will be able to key into the eNHIA platform.
Technology has several advantages and has yielded several benefits for the health insurance ecosystem. The effect of eNHIA is already being felt.
We are developing an identity system whereby your phone number, your NHIS number, and NIN number are now encrypted as a unique identifier. For example, if you get to the hospital and you don't remember your NHIS number, you must also be able to remember your phone number. You must be able to remember perhaps your NIN. If you remember either of these three, you start accessing care immediately, because there will be an interface whereby it will be keyed into and your record will come out. That will address the issue of stolen identity theft. It ensures that it is only the enrollee that is enrolled that will access care. So the enrollees, we know that yes, they can go to the hospital and access care seamlessly. Then secondly, as we have mentioned before, we have developed a national call center, which is even the baby of my DG. That's Professor Muhammad Nasir Sambo. That is his baby. He's so passionate about it, to ensure that most of the grievances are addressed real time.
This technology will also help create awareness and help enrollees seek redress on any issues encountered during accessing care.
Enrollees must know, what are my rights? What are the drugs that I'm entitled to? My benefit package. Are they reading all of this? Or you just get to the facility and you are told you are not entitled to this and you walk away? They are available handy. Check on our portal, check on our website, and then see. If you show them that this, I'm entitled to this, and then you lay the proper complaint, no one will deny you access. But in ignorance, you lose your rights. So enrollees must also wake up and know that this technology is for them. It's for them. We are bringing all of this so they can access care. Their rights are not, they can access health care fully. You know your right, you tell them, they say this drug is not covered, and you have that document that is showing that the drug is covered, you'll be attended to. And if peradventure you are not attended to, you make that call to the call center. Immediately it moves to the national headquarters. That's where the call center is, the headquarters, and it will be rooted to the state.
Aside other advantages, the eNHIA will also integrate the state social health insurance agencies into the NHIA platform.
We're also collaborating with the state social health insurance agencies, because what the management also did when they came in, when under Professor Nasir Sambo, is that we had a program that we call Health Insurance Under One Roof, bringing all the stakeholders. You know, health is on the concurrent list. There's nothing binding them together. But then he and his team decided to bring health insurance on that one, brought them together. We now have a single policy. Let's work together to deepen health in this country, and it's working very fine. That is what we are interconnecting. That's the architecture that we are now using information technology to interconnect, to share data. So enrollees, wherever you are, either through the state agencies, either through our state offices, you have access to information and access to healthcare.
The eNHIA is one of its kind in Nigeria, where a totally Nigerian solution is being deployed through collaboration between government and government agencies like NACHCOMSAT, NIMSI, NIDDA, etc. Little wonder then that the NHIA recently received an award from NIDDA for its compliance to technology.
Welcome back from that break. Easy access to healthcare continues with our stakeholders segment. Our stakeholders segment for this week is Dr. Nura Ibrahim Kazaure, the Executive Secretary, Jigawa State Contributory Healthcare Management Agency. For Dr. Nura, he is optimistic that the NHIA Act is a good move and a vehicle for the attainment of universal health coverage.
I think this act is very, very important. More so, when you look at the initial National Health Insurance Act that did not mandate maybe health insurance to be a kind of mandatory, but this National Health Insurance Authority law has made health insurance mandatory for each and every legal resident, and this is key. This is very, very important, because as far as I'm concerned, and if this is the only thing this law would provide, I think we are good to go. That is it. And when you look at other things equally that the Act provide, most importantly, this vulnerable group fund, because it's very key. We are talking about 83 million Nigerians that are vulnerable. So if we are going to support this vulnerable group, we are going a long way to ensure the attainment of universal health coverage.
Dr. Nura said, though Jigawa State operates its own law, the new NHIA Act will strengthen it further.
Although my law requires each resident in Jigawa State to have health insurance, be it whether you are within the public or private purview, whether you are employed or you're not employed. So it's mandatory in my state. As far as the mandatory side is concerned, we have already covered that. But as rightly said by the DG of the NHIA, because by the time we got the monies for the vulnerable fund, they're going to remit the money to states, because this is where the populations are. And so I'm sure that this act will increase the fiscal space, that's the financial fiscal space, for us to be able to do what we cannot do before, because everything relies on the coverage. How many people, how many lives can you cover? So if we are going to get support, financial support to cover more people, for example, now the Basic Care Provision Fund money is covering just about 60,000 people in Jigawa. Jigawa has a population over 6 million by projection, yes. So it's virtually a tip of the iceberg. So I'm sure that with the vulnerable group fund coming into place, we are going to make headway. We are going to cover many more individuals that needs to be covered.
He added that the Act will solidify the relationship and serve as an avenue for the collaboration within the NHIA and the state social health insurance agencies.
Our level of interaction will continue to increase, because the National Health Insurance Authority law now, recognizes again, the state social health insurance agencies. Initially, we are not recognized because the 2014 Act, I think there was no single state that has even state social health insurance, because I think the earliest one was in 2015. Yes, so at least this one recognized the state social insurance. So we have a legal mandate now to collaborate, to cooperate, with the NHIA as a regulator, as a promoter, as also an integrator of health insurance system. I think we are going to go a long way. We are going to have more of collaboration. I think what we've seen in the past is just the beginning.
Dr. Nura said that the new act has defined the functions of the authority as being to the objective of the new act, which is to regulate, promote, and integrate stakeholders in the health insurance ecospace.
Now, NHIS, because we have what we call the matrix of coverage within the health insurance ecosystem. Even before we came on board, it's the NHIA that is doing all the things. Currently, we are on board, so there is shared responsibility. Who do this? Who do states cover? Who do federal cover? Like maybe the federal government employee is covered by the NHIA. So, in this case, NHIA is acting as implementer. Most of the regulations in terms of accreditation, in terms of, who to bring on board, ETPAs, HMOs, these are all regulated by the NHIA. So I think it's a good thing that NHIA is having this triple role as both a promoter, regulator, and also implementer.
In conclusion, Dr. Nura applauds the efforts of the leadership of the NHIA to see into the success of the health insurance in Nigeria.
Any avenue, I find myself, I always thank the current leadership of the NHIA of making sure that it ensure the decentralization of the health insurance to states, because this is a very good thing that they did. And when you look at how collaborative and how cooperative the DG is, always bringing us on board. Whatever is being discussed, he will try and contact the shares, he will come around, we put it together and come up with amicable resolution or recommendation as far as health insurance system is concerned. I think it's great.
That was Dr. Nura Ibrahim Kazaure, CEO, Jigawa State Contributory Healthcare Management Agency, speaking on the impact of the new NHIA Act and how it will boost the health insurance space. Up next on the program, your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: are children covered under NHIS?
If you look at the way the NHIS is structured, what we call the formal sector program, the public sector program, if a principal who is like the worker gets enrolled, who's the spouse, the children biological children under that principal, 4 of them under the age of 18 years, covered under the program until they get to the age of 18, when they can now join other programs to continue.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
As I sign off, I want to urge you to take advantage of the various health insurance options available to you and your loved ones, particularly under the gift shift program of the NHIA, to protect yourself from out-of-pocket expenses. When medical emergencies arise, you will be glad you did. Until I come your way again next week, spread the good news of easy access to healthcare and stay safe.